Hello everyone, welcome back to my channel. Today I'm going to be sharing with you a video to help you pass the MRCOG Part 3 exam. If there is one video that you watch before taking the Part 3, make sure it's this one. I'm going to share with you some tips and tricks to help you prepare for the exam and more importantly, pass the exam. I'm also very excited as I'm sharing with you a very useful resource that I've just come across, and I couldn't wait but to let you all know that this resource is out there and it could be yours as soon as you can get your hands on the subscription and start benefiting from it, so that all your hard work actually results in success in the Part 3 exam. As you all know, the MRCOG Part 3 exam has 14 stations. Each station has got a 2-minute reading time, followed by 10 minutes of the actual station time. Now there's different domains being tested in the MRCOG Part 3 exam, which include patient safety, communication with patients, communication with colleagues, information gathering, applied clinical knowledge. So it's very different to your MRCOG Part 1 and 2 exam in that those exams were mainly testing knowledge and applied clinical knowledge, information gathering. But this exam goes a bit further, where it's also testing your communication, but not just with patients, even your team members, so your colleagues as well. So you could easily be given a station where you have to teach a scenario, a procedure to a younger trainee. It could be somebody trying to get advice from you over the telephone. It could be somebody who wants some help because they've had a bullying episode that they've experienced on the ward. So it could be lots of different scenarios, and the aim of this exam is a bit of a holistic one, where your knowledge, yes, is being tested for sure, but a lot of other aspects of being a good doctor. Right, so let's get to the main point, and that is that I've come across a very important and useful resource on the MRCOG Part 3 exam, and it's called the MasterMRCOG. Now, some of you may have used this resource to help you pass the MRCOG Part 2 and Part 1 exams. As you know, that this resource has got lots of recall exam questions, so it's very much in the exam style. It covers the syllabus really well and thorough. It's got about 300 case scenarios. Now, let me tell you that I haven't come across anything similar on the internet out there that would cover such a vast majority of the syllabus with so many exam recall questions. Because what you do want to do when you're preparing for any exam is try and practice questions that are likely to come up or have come up in the past, because that's the best way to get you into the rhythm of the exam. There's no point preparing yourself for something that is unlikely to be tested. And what the MasterMRCOG has done very well is covered all of this for you in a website format. Right, so the MasterMRCOG is a subscription-based website. So as soon as you sign up to the website, you would be given a username and a password. Once you've got your hands onto the username and the password, there you go. you can start using the subscription straight away, which is really where this comes so handy, because a lot of the MRCOG Part 3 courses, the preparation is still done on a course based format, which means you have to be available on the dates that the course is being offered. And say if you were on call or busy with a different life commitment and you're not able to do the course on those dates, then really you can't benefit from the preparation, which is a shame because there isn't much out there to help you prepare for the exam. So this is where this comes handy, because as soon as you got your subscription, you can start going through the scenarios, and all you need is a study partner to be able to pair up with, so you can practice these stations in live setting in a timely manner, where one of you could be the candidate and the other one could be the examiner and the patient being questioned. So I've taken a sample question from the Master MRCOG. So you can see that it gives you the domains being tested on the top, followed by a case scenario, and then what it expects you to do. So this is a very, very, very similar format to the real exam when it comes to the case scenarios. It then follows on with a mark scheme as to what was expected of the candidate, and goes into a lot of thorough and deeper discussion about the scenario itself. So like you can see from the scenario, it then follows on to discussion and questions. So what it expects the candidate to ask, followed by a mark scheme as to, and more deeper knowledge about the topic, just so that once you have gone through a topic on this website, you'll be very aware and be able to answer really any questions about that topic in the real exam. Some important snapshots of the actual website, so I can show you what the MasterMRCOG website has got to offer you. Now, labour ward prioritization is a very, very important station. And if you speak to any candidates who've done the exam before, they will talk about how they really struggled to finish the scenario in time. And having lots of examples to be able to practice this station can only make you better. And I cannot tell you how lucky you are to have this resource at hand, because it's not something we had when we were studying for our exams. And all we really had was a course that you could perhaps get your hands on, a few textbooks that you practiced from, but it did not offer such a wide variety of exam topics that was so well covered, so that you could get lots of practice, and that automatically increases your chances of success. The MasterMRCOG website is also very helpfully segregated into different groups that the syllabus wants you to cover. So you've got your early pregnancy care, you've got your antenatal, your intrapartum, your postpartum, your maternal medicine, your oncology, urogynecology, you've got your reproductive medicine, you've got things like contraception in there, which is always a very, very hot topic. You've also got some teaching stations to help you practice your teaching and communication with more junior colleagues. I've taken an example from the maternal medicine topics for you, and you can see for yourself how much of variety of maternal medicine topics are being covered, which would be very difficult if you had to go and look it all up yourself. And try and do all the homework, because let's be honest, there is life around us, and we do all get distracted and busy with general life as well. So we haven't got a lot of time on our hands as being doctors. So if we do have a resource that does make it all concise for us and puts it all together, then why not, benefit from it so that you could increase your chances of passing this exam. I've also taken the reproductive and sexual health topics to show you, again, the variety of the topics being covered under each of the subheadings. So say if you were to click on fertility, contraception, there'd be again further subdivisions which would again cover the syllabus for you. So there's lots and lots of cases to discuss practice. And it's very likely that a lot of these topics that you do happen to practice would actually make up the real exam. The teaching stations subheading. Now you can see how much of a variety this station has got as well, and to be able to talk about these topics is quite important because you're bound to get a station where you probably are going to be communicating with a junior colleague and explaining things to them, and you can see how having the right terminology and having already practiced it would just give you a good head start to the station. Apart from having all these useful scenarios and subheadings for you, it's got the MasterMRCOG website has also got a very useful subdivision which includes basically, it reads as the slide says, how to pass your MRCOG Part 3. It's got tips and tricks. It's got why candidates fail. It's got things like the syllabus. It's also got a timer on the website which tells you exactly when the next exam is, and also when to register for the exam, and when are the results likely to be announced. Now, because the MRCOG Part 3 is a practical exam, it's very important to practice. The more you practice for this exam, the very, very, very more likely that you will pass this exam. And I really mean this when I say this, because all the candidates that I have tutored or come across over the years, and from my personal experience, I can tell that the more you've practiced, the more you're going to be in the loop to know what to say exactly on the exam day, because you know what, the nerves get the better of us, and if we are going to be naturally nervous on the day. So no matter what we know, but until we turn up on the day and say it, nobody's gonna believe us or mark us for it. So it's very important to be able to say everything you wanted to say. And we all know that to be able to do that, the best thing is to practice. The more we practice for this exam, the more likely that we will be awarded with success. And the more scenarios you have that you could come across prior to the exam, the more prepared you will be. And with this resource having up to 300 case scenarios, it's something that is well worth investing in order for it to be quite successful for you. And as I said, it's got lots of important and useful information about the Part 3 exam. If you've got any questions or any comments about the Part 3, please post it down in the comment section and I will answer them for you. Now, I do offer an MRCOG Part 3 practice stations as well. So if at any point in your preparation you feel like you needed more of a one-to-one help with passing the exam and some real-time feedback, I am more than happy for you to sign up to the course, and we can agree for a mutual time and date to help you get your hands on to this practice stations, so you can practice loads before you do your exam. I'll be leaving a link for both the MasterMRCOG website and the practice stations that I offer underneath the video, so you could have quick access to it. Thank you so much for listening. I hope this video was really useful for you. Let me know, and don't forget to hit the like button.